Hi, Dr. Preeya, and welcome to Talking Allergies.
Thank you for having me.
Could you start off by talking a little bit about your background?
Sure. So I am a practicing GP in Melbourne. So I work in Richmond in metropolitan Melbourne. I'm in the clinic 2 days a week. I'm also a mum of two. And I guess I have this kind of other life where I write books, I go and present on TV, and I have a podcast. So I kind of have the best of both worlds. But yeah, I'm a mum of two. I'm trying to feed kids constantly. I'm very conscious of preventative health, of doing what I can through lifestyle interventions to look after not only myself and my family, but also my patients, pass on little pearls of wisdom. And that's what I also try and do through my social media platform on Instagram.
It sounds like a variety of different areas and information and experiences too.
Yeah, so it's a busy life and it's a full plate, as the name of the cookbook suggests. So constantly juggling and trying to find time, but so far it's working.
As a practicing GP, how have you seen the impact of allergies in your work?
So I see a lot in the allergy space. So I have plenty of patients who are dealing and living with food allergy. So I am the kind of the GP who's doing, allergy plans for childcare centres, for schools, for workplaces. I'm the GP who's ensuring that we're doing everything we can to reduce the risk of an anaphylactic reaction, making sure EpiPens are up to date. And I'm also the GP who's kind of there for patients dealing with the psychological and the emotional burden of either living with a food allergy or caring for a child with a food allergy. And so that can be really stressful, as I'm sure your community is aware. But that's kind of, I'm often that support person, particularly for parents and caregivers, ensuring that we're managing stress as well as we can, ensuring that care plans are up to date, that we're doing everything to reduce risk, but also ensure that everyone feels supported enough to go to school and navigate the lunchbox and birthday parties with some confidence. So yeah, I guess I see a lot in the allergy space, a lot in the skin allergy space as well. And then I guess the other hat that I wear as a GP is in allergy prevention. And so I do a lot with patients who've got younger children who are starting solids on trying to reduce the risk of food allergies by introducing those common allergy causing foods into the diet before the age of 1, keeping them in the diet if there's no reaction. But I guess that's the other flip side. So yes, I'm there for all the management stuff, but I'm also doing the prevention, which is the cool part of being a GP.
GPs have a very big role as well as the first point of call.
Absolutely. So we are there as the first port of call for lots of things in the community. But I guess for the kind of allergy space, it's we're the people that, initially people will come and go, is this, isn't this, what do you think it is? My child has consumed this. I saw this reaction with photographs. So it's, we have a lot of knowledge, or we know a little bit about everything, and we know lots about some particular things, but it just means that I see a lot of patients who go, is this, isn't it, Preeya? Which can be a tricky part of the job, but also an exciting one.
As a GP, how do you coordinate the care with other healthcare providers?
So look, that can look really different for every patient. So my job as the GP is to make sure that all the care providers, be it an allergist, so a non-GP specialist who's an allergist or immunologist, the dietitian who's often involved, it's my job to make sure that we're all communicating and that the patient is really getting holistic management, not just this kind of silo of the allergist, immunologist, then the silo of the dietitian, and then the silo of me, but actually making sure that it's all coming together. That whatever the dietitian, for instance, is suggesting, so if there's a food allergy and we're having to avoid certain foods and the dietitian is involved to make sure we're still meeting nutritional requirements, which is very common. That's a common way that I see dietitians and food allergies in my consulting room. Then it's my job to also ensure the allergist or the immunologist is aware of the food groups that we're trying to up titrate to make sure all the nutritional needs are met, and actually to make sure the patient is aware of everything going on. And that's probably the key part of my job, is making sure the patient is aware of all the correspondence I'm getting, of everyone's plans, what they're thinking, and communicating it to them and making sure the patient's empowered. Because they're in the box seat, they're in the driver's seat, and half the time things will be in a letter. and it hasn't been communicated to the patient. So I make sure, that's a big part of my job, making sure the patient's in the know.
That's a very big part of healthcare, is educating and empowering people living with allergies.
Absolutely. People with allergies, I think, need to be empowered with all the knowledge. And if you're seeing different care providers, sometimes it can feel like it's not all working together. And that's when you need to say to the GP, look, I really need to know how this roadmap fits together. And that's where I often get out a piece of A4 paper and kind of link it all together so the patient can see the bigger picture and how it all comes together for them.
Have you seen any challenges or barriers to people accessing care for their allergies?
I think a big part of a big barrier that we're seeing at the moment in general practice is it can be really hard to actually go and see an allergist or an immunologist. So if someone comes and sees me with a presentation and I'm umming and ahhing, I'm wondering if it is in fact an allergy that's involving the immune system, it can be quite difficult at the moment to actually get the patient seen, either by a private allergist or immunologist, or by someone in the public healthcare system because of the wait lists and the burden on the public healthcare system. So it just means it can be really tricky for patients to get the answers they want, because sometimes we need skin prick testing. Allergies, as we all know, can be very nuanced. So sometimes I go, oh, isn't it? I need a little bit of extra help from an expert in the area, someone who's a real expert in this niche area. And it can be hard to get that opinion, which means that patients can often feel like they're in the wilderness for a little while. It can be really challenging.
It can be. It definitely can be. Now, Dr. Preeya, you also created this beautiful book as well. Could you tell a little bit about it?
Yeah, so this is Full Plate. This is a cookbook. This is something I've always wanted to do. And it really is just easy, simple cooking for everyone. The whole thing is one meal for the whole family. So in the book, I've got a key at the top for allergies. So it tells you, which recipes are gluten-free, dairy-free, peanut-free, egg-free, tree nut-free. There's lots of others. So it just means it's easy for people to navigate. And what I've tried to do is just simple, veggie-packed cooking. And you don't need any cooking skills, but it's yummy, it's easy, it's doable. And I'm talking about, reducing salt intake, lots of rainbows, what I call fruit and veggies, to yield all the benefits for the body and the brain. So it's not your coffee table cookbook. I keep saying this. It's the one you'll actually use. You're going to have it, there'll be corners down, there'll be tomatoes splashed all over it because you'll actually use it. It's for simple everyday cooking. And if you've got someone who's got an allergy or a fussy eater or a kid starting solids, whoever it is, you can adapt the meal for them and I tell you how to do it.
It sounds fantastic, especially not needing all of the skills cooking, that you can just go along with it.
Correct. So I've assumed no skills because I am at the end of the day just a home cook. So I often say in there, just chop haphazardly, get the kids involved, food exposures to reduce the risk of fussy eating, get them to love and become familiar with rainbows. And so it doesn't matter how stuff is chopped in this book, it will still taste good and be good for you.
In the book, you also have some information on allergies and intolerances. Did this factor into your book?
Absolutely. So what I've tried to do at the start of the book is I talk a lot about my ethos when it comes to food, what I talk about with patients. I talk about the evidence when it comes to, why you might want to have a diet high in fruit and veggies, reduce salt intake for adults and kids as well. I give some tips for feeding children, so starting solids, how to deal with fussy eating. But the allergies and intolerances section, I included that because I'm a doctor. And because I often see that people get really confused between allergies and intolerances, which are completely different entities, as I think most people here would know. And so I do give a bit of a spiel there that, allergies can be life-threatening, that involves the immune system, that intolerances, tend not to be life-threatening, they don't involve the immune system. So I break it down. And when I refer to the key, I'm really talking to people with allergies, the peanut-free, tree nut-free, dairy-free. If someone's lactose intolerant, they might still be able to include some of the ingredients because we know that people have a different threshold. But for people with allergies, it's really clear as to which recipes are going to work for you. So yeah, it was a big part of the book.
You also touch on some vital questions in there, like when to add solids and introduce those potential allergy foods. Could you touch a little bit on on that?
Yeah, so that's going back to, my role in prevention as a GP when I talked about preventing food allergies. And so throughout the book, because it's one meal for the whole family, I talk about feeding kids, how you can tailor recipes to kids, blitz it now, or don't add the spice, don't add honey for kids under one, all those sorts of tips in it. But I do repeatedly point out through the book which recipes are great for introducing or keeping those common allergy causing foods in the diet for infants. So we know that there are those common allergy causing foods like shellfish, fish, peanut protein, tree nuts, all of them, there's so many. And so I do point out to the reader or the cooker, whoever it is, you're getting this into the diet, sprinkle some sesame seeds. That's a great way to get the common allergy causing food into your child's diet, or keep it in the diet if it's already in there, to reduce the risk of food allergies. So it's trying to make it really easy for parents and caregivers.
Thank you so much for touching on that. But I've got the most important question here. What is your favourite recipe in the book?
That's a really tricky one. So I've been asked this so many times recently, and I have to say there's not one, but I have my top three if I'm allowed.
Okay, you're allowed.
I'm allowed. So staple beans is a favourite. So a lot of the recipes are budget friendly. It's all, canned beans, frozen veg, what's in season. So the canned beans are really good, versatile, heaps of veg. My kids love it. We eat it at least once a fortnight. The dal is really good. That's my family dal, easy to whip up, lots of rainbows. And the 𝘛𝘢𝘭𝘬𝘪𝘳𝘦 is a family favourite.
Quite a range there with those three.
Yes, there is. There's lots of different recipes in there, but they're all easy. So if you're thinking dal and 𝘛𝘢𝘭𝘬𝘪, I have to say there are some classics in there, like zucchini slice and 𝘛𝘢𝘭𝘬𝘪, that I do my Preeya spin on. So there's no white sauce, for instance. I do creamed corn instead in the 𝘛𝘢𝘭𝘬𝘪, so no saturated fat, but lots of veggies. And so there's a couple of weird Preeyaisms. Don't knock it till you try it. I promise it's yummy.
I love it. Love the Preeyaisms.
Yes. You'll have some fun whilst cooking. There's a couple of jokes through there. So, yeah, you'll have some fun. Some laughs and giggles on the way.
How are you wanting people to use your book?
Well, I want them to use it, is the basics. Like, it's not a coffee table cookbook. I want people to actually use it, to go, what am I going to cook for the week? To find yummy food that everyone's going to love, that you're going to have joy cooking. There's not too many ingredients. It's not difficult. It's all in season. I say to you, if capsicum's $10.99 a kilo as it is now, don't use it in the cacciatore. Use zucchini instead, which is in season. I just want people to have some fun. I want to bring joy back. And I think a lot of stuff has gotten really muddy and confusing for people. We know diet culture plays a role. There's a lot of unqualified voices telling people not to eat certain foods. This is kind of you can eat everything. Here's a couple of tips and tricks, and you can create yummy food easily that's great for the body and the brain.
That's fantastic information. Where can people find your book and purchase it?
So it's in all bookstores. You can really walk into anywhere, Dymocks, Readings, wherever you like, Big W, Kmart, and it's there. Full Plate is the name of it. So you'll see me cooking on the cover. Go and grab a copy.
You also mentioned that you're on social media. Is there a handle that people should look out for, Preeya?
So it's very easy. It's Dr, as in the word fully spelt out, Preeya.Alexander. So really easy.
It's fantastic. Is there anything else that you would like to say to the allergy community?
I think that it can be really tricky. I definitely see the emotional and psychological burden of living with allergies in whatever form they are, if you're a parent or caregiver. So it can be really difficult, exhausting, emotionally taxing, and I acknowledge that. And hopefully, if you do enjoy Full Plate or you do get a copy, hopefully you find it a little bit easier to create some deliciousness at mealtime with the key that's in there. Hopefully it makes it a bit easier.
Fantastic. Thank you so much, Preeya, for being on Talking Allergies and for sharing a bit about your background and also about Full Plate.
Thanks for having me on.